Hello, good evening. This is Isha Thakur and I welcome you to Live's YouTube channel for another live session. In this session, we have the privilege to host Dr. Mansa Kaja, a psychiatrist from Sri Mansa Psychiatric Nursery Home, Vijayawada. She has experience of 7 years in psychiatry after completing MBBS from Dr. NTR University of Health Sciences in 2019 and MD Psychiatry from Kasturba Medical College in 2017. She has been a speaker at many academic programs on various topics like child psychiatry, sleep medicine, psychological problems in youth, addiction psychiatry. With all of her experience and expertise, she is going to explain the most common issue, sleep and its impact on well-being, among all of us, along with the associated pros and cons. Welcome, Dr. Mansa Kaja, and thank you for taking out time for this session today.
Thank you, Isha. Pleasure to be here.
To our viewers, as we all know, good sleep plays an important role in the overall health of each and every individual. Sleep is involved in many biological processes within the body, and its deficiency is linked to the root of many diseases and disorders. As the world is going through an anxious time of pandemic, many of us are not getting enough sleep due to one or the other reason, but we are unaware of the clinical implications this may lead to. The more time now spent at home with no or very little movement usually affects sleep and leads to implications impacting our lifestyle in general. Thus, to combat this issue, we need knowledge from medical experts like Dr. Mansa, who have come forward to help us with her expert advice. During the next few minutes, Dr. Mansa Kaja will be talking about sleep and its impact on well-being and also the various unknown facts that were not put under the light and we all are unaware of those facts. In this session, she will also put the light on the cause and another reasonable links between insomnia and comorbidities, which may cause more implications on well-being. My request to our viewers who have tuned in, please feel free to ask your questions in the comment section and we will take them later. Over to you, Doctor.
A very good evening, everyone. It's a pleasure to be here and to be part of this awareness program. Many do understand the importance of taking nutritious food in order to be healthy. And also many understand that it's important to exercise well in order to stay fit and but the importance of sleep has been undermined, and many people do not consider sleep as an important aspect or a critical aspect in order to remain healthy. Have you ever wondered how much time do we get in our life in order to sleep? And an average person in his whole lifetime spends around 26 years of his life sleeping. Surprising, isn't it? Is it really necessary to spend so much time on it? Is it? Can we consider it as a waste of time, sleeping so much? We've come across many inspirational speakers, motivational speakers, as well as famous personalities who do say that they spend their lot of time working and doing research or whatever, and they do sleep for very little amount of time, like 3 or 4 hours. Is it really healthy? No. Recently, our attitude towards sleep turned very negligent, I could say. Our lifestyle habits, like in the past, we used to maintain good lifestyle habits, and people used to sleep early, wake up early, and that used to be the routine, especially when farming was our main occupation. But urbanization, recent lifestyle, there are many changes which occurred in our lives, so that we are not maintaining a good routine. There's no proper specific time for sleep or specific time for wake up, and we nap a lot in the day, and we consume excess caffeine and use of alcohol, nicotine. Many things became a part of our lifestyle, and the most important thing which is occupying our lives to a greater extent is the screen use and the digitalization. We use phones a lot even before our sleep. It became a routine for most of us to check our phones before we sleep. So how is this impacting our life as well as our sleep? This all led to a haphazard sleep routine, resulting in sleep deprivation. On one end, there are many individuals who do have a lot of sleep problems, who crave for good sleep and suffer because of it, and roam around doctors. And on other end, we are turning ourselves in such a way that we are becoming negligent towards maintaining a proper sleep habits. So is it really important to talk about sleep? Let me throw some light on how important sleep is and how important it is for us to sleep for adequate duration. And if not, what would the effects be? What would health consequences be? So let me share my PPT. Sleep, as the word sounds, it sounds so simple. And when we observe a person sleeping, we usually observe them in a reclined position with closed eyes, and they do not move much and they do not respond to the stimuli. So it appears to be a very passive process, not involving much dynamics in it. But to be certain about it, there is a lot of physiological processes which are happening in our body as well as brain when we do sleep. And our brain continuously processes information even while we are asleep, and many physiological processes continue happening when we do sleep. Sleep, over a course of night, a person progresses through multiple stages of sleep, and it's a basic structure of the sleep. Like the two main stages, which we call as are rapid eye movement stage as well as non-rapid eye movement stage. This NREM, which we commonly call as, occupies around 75 to 80% of our sleep, and when it comes to REM, it occupies to around 20 to 25% of sleep. And to complete one such cycle of sleep, it will take around 90 to 120 minutes. And as such, we will go through around 4 to 5 cycles in the night in order to make a good night's sleep. Why is it important to know about these stages or these sleep cycles? It is understood according to the research that only if the person goes through all these stages in a proper way, as well as have this certain number of cycles, then only the person will have a good night's restorative sleep, and they'll be able to feel fresh after waking up, and they'll feel that the adequate amount has been spent in the sleeping time. What happens when we actually go to sleep? Initially, we remain in a state of transition between wakefulness as well as drowsiness that occupies most of stage 1 of NREM sleep. And then slowly we'll go to stage 2, wherein like our muscles will relax, body will relax, mind will slow down. This is a stage wherein the person can be easily woken up. It occupies the initial part of our sleep. And later on, we slowly go into this deep NREM sleep, wherein like it is very difficult to wake up the person, and body is in such a state wherein the body recovers and rejuvenates. We as a people go through a lot of stress in our day, and there'll be a lot of wear and tear to the muscles. Not only just as a part of exercise, but the usual activity which we do wears us down a lot. And for us, like any person needs a break, any activity needs a break. In the similar way, even our mind and body needs a break. That's what sleep gives us. So in this stage of sleep, that is the deep NREM sleep, is a sleep which restores and rejuvenates us, makes us feel fresh after we wake up. And it many muscles in the body go through recovery and repair at this point of time. And the immune system of a body, like the ability of a body to fight infections, is also restored during this phase. That is the importance this stage of sleep carries. And next comes REM. REM sleep is a stage wherein the brain activity shoots up. When it is NREM, the brain activity is lower down, body temperature is lower down, everything is lower down. It is a kind of calmer state. When it comes to REM sleep, brain activity shoots up, as well as our nervous system also becomes hyper aroused, but muscles will be paralyzed so that we'll not be able to move, And this is a stage where dreaming occurs. And the reason why the muscles are paralyzed is the reason which prevents us from acting out our dreams. If our muscles are not paralyzed, we act upon our dreams and it leads to injuries and accidents. And this is one kind of sleep problem or sleep disorder we observe in certain individuals, that is particularly specific to REM sleep phase. This progression through stages itself will give us a restorative sleep, and that there are many individuals whose sleep is interrupted because of multiple reasons. It could be as simple as like a pregnant lady who, because of discomfort, couldn't able to sleep, and because of multiple need for bathroom breaks, wherein like the person's sleep gets interrupted. And there are also other individuals who are diabetics or who have chronic pain, arthritis. These all people do have multiple interruptions in the sleep. Such people who undergo these multiple interruptions, they have impaired quality of sleep, though they might get back to sleep immediately after the break, and they might be able to restore their sleep, but their quality is impaired. They do complain that I slept most of the night, doctor, but I am not able to feel fresh, or I'm not able to feel alert, focused. That is the complaint they just give us most of the times. So these the stages which happen during a sleep time. And a few of the functions which I've already discussed is like the sleep has this restorative effect, wherein like we feel rejuvenated and fresh after waking up, and it'll help us adapt to the day next morning, so that we could be active and carry on with our processes. And it also has thermoregulatory rule. It'll restore the immune system, it will regulate the metabolic activities. It's kind of like every system in the body virtually is affected and works during sleep. And it also regulates production of certain hormones which are responsible for bone muscle development. And one interesting fact is it also controls hormones which regulate appetite or our food intake. And that it is surprising to some people to note that, like, if the person is sleep deprived, they might gain weight, they might land into obesity, which most people worry. And it is a complex mechanism which is involved, that like the hormones which are usually regulated are affected if you don't sleep well, and it might lead to obesity later on. And one most important function sleep carries is memory. Sleep is very important, especially the REM phase of sleep, which we've discussed. That is the phase wherein the memory consolidation occurs. We do learn a lot of new things in a day, but this new things get integrated with our old memories, which are already there and get stored for long term during our sleep. That is the reason many people, especially before exams, they get themselves sleep deprived and try to study throughout the night, entire night, and try to vomit everything the next day during the exam. But if they don't sleep well, if they deprive themselves from sleep, it'll definitely affect their memory and also their performance in the exams. How much is normally essential? A lot of research gives different numbers, and it is definitely important to have a sufficient amount of sleep in order to feel alert, refreshed, and also to avoid excess daytime sleepiness. The common number of hours recommended are 7 to 9 hours of sleep according to the guidelines. Most young adults need this amount of sleep, and when it comes to older adults, they will be requiring at least 7 to 8 hours of sleep. That is like above 65-year-old individuals. And as we see newborns, infants, they do require a lot of amount of hours during hours of sleep. Especially newborns, they'll be requiring up to 18 19 hours with intermittent wakefulness. They do sleep a lot and remain awake for a very less duration. And 2 months to 3 years, they'll be requiring approximately 11 to 13 hours, and 3 to 18 years, 9 to 10 hours. This 3 to 18 years is the school going as well as the initial college going age. These are the ages where parents are really behind children in order to help them study. Actually, they want to help them study. They push them to study, but it is also important for them to remember that enough and adequate amount of sleep for them is definitely essential for them to function well in the school, perform well in the school, and as well as the exams. Not so enough sleep during those years, especially like 9 to 10 hours as advised, will definitely impair their performance as well as memory. And coming to adults, as we've discussed, it's at least 7 to 9 hours of sleep is advisable. Coming to sleep disorders, there are numerous number of sleep disorders which we come across as a part of our daily practice. But the most common complaint which comes to us is insomnia. That is when a person has trouble initiating and maintaining a sleep, or just initiating sleep, or just maintaining sleep, and resulting or terminal insomnia, which we call as, that is when the person wakes up too early and they do not feel refreshed after sleeping. This is the most common complaint. It could be individually present or combinedly present. And there are also secondary insomnias associated with other comorbid conditions, as I've discussed, certain individuals with chronic pain disorders, arthritis, or diabetes, hypertension. These individuals also do have sleep problems comorbid along with their existing conditions. And does everyone do have sleep problem? Not exactly. There is the sleep disturbance occurs to certain extent in a number of individuals, but what we call as persistent insomnia is when the sleep disturbance occurs for more than 3 days in a week, and which remains persistent for at least 3 months. If they do have these kind of sleep complaints persisting for more than 3 months, we call them chronic insomniacs or persistent insomnia. Around 10 to 30% of the individuals, especially adults, do suffer from chronic insomnia. It is not a small number, I could say. 10 to 30% is a significant number affecting population at a wider range. So many individuals, many adults do suffer from sleep issues, and there are also sleep issues also become certain higher, like in older adults, elderly individuals. It occurs to an extent of around 30 to 50%. And we also see many sleep issues in pregnant women, and it happens to be more than 50% of individuals of pregnant women do have these sleep issues. When it comes to insomnia, as we discussed, it could be a problem with initiation. It could be a problem with duration of the number of sleep hours a person could get, and it could also be an issue of the quality of sleep which the person gets. There are many individuals who complain that they've slept for adequate duration but with poor quality. This happens to be taken as a problem once when the person do have adequate opportunity in order to get a normal sleep. That is when the person sleeps in a good environment. Only then we do consider it as a problem, and they also should have certain amount of daytime impairment. And sleep onset issues which we are talking about are mostly seen in individuals who have jet lag or who have shift works. These are the individuals who have problem with the initiation of sleep. And many people who have sleep maintenance issues are individuals who have substance use problems, like who consume alcohol, who smoke a lot, or who take caffeine in larger quantities. And there are individuals who do have sleep apnea as a problem. And there are individuals who have restless legs, like they have jerky legs during sleep, wherein like they won't realize that they are having a sleep problem, and they just complain their quality of sleep is poor, but they don't realize that they do have problems with their legs and jerky legs. That will be usually identified by the partner. And periodic limb movement disorders is what we call, like a technical term for it. There are also other causes like drugs, medications, which the people usually take, and pain, diabetes. Many individuals do have medical conditions. These are the disorders which could lead to sleep problems. And this nighttime sleep difficulty usually should be followed by daytime sleepiness. That is, they do complain of excess sleepiness during the day, or they remain drowsy during the day. And they also report other problems, like when a person is sleep deprived, he feels very tired next day morning, and his ability to concentrate or remain alert will be affected. They won't be able to make decisions fast, and the reaction time will be slow. That is, like if anyone asks to do certain action, or when they need to answer anything, they'll be reacting very slowly. They'll be in a kind of gloomy state, or a state wherein like the concentration levels are very much affected. All these leads to irritability, mood disturbances in the individuals. And they are also these problems with attention, memory, and irritability. It leads to various consequences, such as like absenteeism at work. They won't be able to focus on work, or on the academics, or school or college work. As well as there are many individuals who met with accidents because of not being able to stay alert. And it also leads to economic loss on the whole, because of absenteeism or decreased productivity on a greater picture. Who are prone, we've discussed certain causes of insomnia, and certain other things are who are prone to this insomnia. There are certain individuals who do have hyperarousal. That is like their ability to remain calm is less. They are easily aroused or easily activated. In such individuals, insomnia could be an issue. And there are many individuals who worry or think about things a lot. Though they are not depressed, or though they are not anxious, they do think or worry about things to a greater extent, that that will impair the sleep, especially the sleep onset. Or any stressful life event, like a death, or any accident to a family member, or any worrying event could precipitate sleep deprivation. Or any new illness, diagnosis with HIV, or diagnosis with cancer, or even diagnosis with diabetes, hypertension couldn't be taken by certain individuals, and it results in insomnia. And once insomnia sets in, like once the person starts having difficulty, they do adapt to it in a wrong way. Like they compensate by napping a lot in the morning, which will further interfere with their nighttime sleep, and results in problems. And they, even if they don't get to sleep, they try to remain in the bed, and that increases the worry that they are not able to sleep, or the onset is being delayed, which will further arouse them, and result in problems with sleep. And there are certain circadian rhythm problems, and dysregulation of sleep. And as we are discussing, many medications like antidepressants, anti-epileptics, many other medications can also result in problems with sleep. Coming to psychiatric disorders, I'll be discussing a bit more about it, like in the further slides, like anxiety, depression, schizophrenia, even neurological disorders like Alzheimer's, Parkinson's. These all are characterized by sleep issues. And as we discussed, intake of alcohol, though it's a myth or misconception people carry, that if they do take alcohol, they get to sleep well. or when they are stressed, that stress will be relieved by alcohol. But it is very temporary and transient. Though they will be able to sleep early, they'll be aroused immediately. They'll be sleep. They'll arouse in mid of their sleep, and they'll be having difficulty to sleep later on. So it's a maladaptive coping mechanism people use in order to deal with sleep deprivation and stress, but it won't be helpful. And in the same way, people consume a lot of caffeine, and people who smoke cigarettes, when they do it in the evening, it will affect their sleep. We've been discussing the effects of sleep deprivation, and I've discussed the effects like mentally, irritability, cognitive impairment, memory problems. There are in certain extreme states wherein like the person is sleep deprived for longer durations, it might result in hallucinatory phenomena wherein like they'll be imagining things, they'll be hearing voices, and they'll be very restless. Like symptoms similar to ADHD is like they become very restless, agitated, and there is no organ which is not affected because of sleep deprivation, especially the heart and the brain not only mentally but also organically. There are risks of stroke, there is risk of heart disease, there is risk of immune system impairment and cause of infections. It also affects individuals with diabetes, and there are also other things, as I've discussed. It might result in obesity, and it also affects growth. Few important medical consequences which we need to discuss are hypertension and diabetes. It has been shown that like the increased prevalence of hypertension has been seen in individuals with less than 8-hour duration, and especially when it comes to less than 5 hours, the rate almost doubled. The prevalence of hypertension, like the number of individuals who can develop hypertension when they are sleep deprived, almost doubled if they sleep less than 5 hours. Many might be wondering how come like a person become hypertensive if they don't sleep well. Sleep, as I said, has many functions, and it regulates many hormones which modulate stress. And in the same way, when the person is sleep deprived, this hormone dysregulations happen, and they predispose an individual to develop hypertension. In the same way, diabetes, as the number of hours we sleep decrease, the risk of a person becoming diabetic increases, because when the person is sleep deprived, there's a hormone called cortisol which increases in the body. It leads to insulin resistance. Though insulin is there in the body, it will be resistant to action, and thus glucose levels in the body will increase, resulting in a diabetic condition. So anxiety and depression, as I was speaking, it is a bidirectional relationship. But even in the medical cases, hypertension and diabetes, those individuals do have problems with sleep. And if they don't sleep well, they do develop diabetes and hypertension. In the same way, when it comes to anxiety and depression, these are the psychiatric disorders wherein we see commonly people commonly having sleep problems with. Many people who are anxious, they worry a lot, they ruminate a lot, resulting in many sleep disturbances. In the similar way, depressive disorder, almost around 40 to 50% of the individuals do have sleep problems. And sometimes when we treat sleep problems, even the symptoms of depression might elevate. And even in bipolar disorder, other adjustment disorders, schizophrenia, the most common complaint they come to us with sleep is with sleep. And many individuals do say like, please treat me, madam, for sleep, and that's it, like my problem will be solved. To such an extent, they'll be sleep deprived, sleep affected, and they'll be craving for help. So finally, when it comes to management, it's important, though, as I said, the sound of the word sleep sounds simple, the causes are numerous. There could be multiple number of causes which might result in sleep deprivation. So it's important to assess the cause and why the person is sleep deprived. And if there is any medical condition, it needs to be treated along with treatment of sleep. And if the person is having taking substance like alcohol or smoking, it needs to be dealt in along with the treatment of sleep. And there are only then, along with the cause, sleep also need to be treated. And there are non-pharmacological and pharmacological strategies. And when it comes to short-term sleep issues, medication, pharmacotherapy will suffice. And when it comes to long-term sleep problems, chronic insomnia, persistent insomnia, it's important to have a combined approach of using medication. Like there are many drugs like zolpidem, zaleplone, Z drugs, which we call as. Along with them, it is also important to use cognitive behavioral strategies like relaxation training, stimulus control instructions, sleep restriction, any cognitive therapy, and sleep hygiene measures. Description of these methods is beyond this discussion since the time is limited, and thus there are many strategies which could be followed, which could help individuals on a long-term basis. So medication will help on a short-term basis for sleep sustenance and maintenance. For longer term, it's important to take medications as well as these psychological therapy strategies. So you can it is important for us to know that insomnia or sleep problem could it is known to us. It will be understandable that we are suffering from it, but going to the doctor, taking treatment is what the problem is. Many individuals do consider it will get adjusted on its own, or it's not a problem, and should I consult a psychiatrist for a sleep issue? There's a stigma around it. There are a lot of things which are barriers between a patient and a doctor, but it is a problem of significance which need to be treated. You could understand your problems. You can check. There are many scales in the internet which are available, and you can estimate your scores, and you can finally consult a doctor. Thus, it is an essential important aspect of life. It will affect us in many ways: physically, mentally, socially. And as I've mentioned, it's important to be important. The person needs to be evaluated properly, understand what the problems or causes of sleep issues are. Those need to be dealt, since they carry important, significant consequences on life, medically as well as mentally, like diabetes, hypertension, cardiovascular diseases, stroke. There are a lot of issues, medical issues, which could come up and which would reduce the lifespan of an individual. Thus, through good treatment and individualized treatment, person can sleep well happily for a longer time.
Thank you for providing us with such insights over this particular problem, Dr. Manasa. Now we'll take some questions from our viewers. So the first question we have, Doctor, how does daytime naps affect sleep patterns?
As I've mentioned, it's important to know that, like, when we do nap during daytime, it will affect our nighttime sleep, especially when the naps are for longer than 30 minutes. Like when people do nap for 1 hour, 2 hours, that will reduce, that will increase the sleep latency, and the time the person takes in order to sleep or have an onset of sleep will be prolonged. So it's important to it is advisable not to nap in the day, but if the person requires napping, it is advisable to be it not to be in the later part of the day. It should be in the early part of the day, and around 30 minutes or less, not more than that.
So another question we have from our viewer, Doctor, that what is the best sleep
Sorry, best sleep
environment?
Okay. Uh, um, it's a calm environment. Like, it should be noise free. There shouldn't be shouldn't be any noises around. People who live in noisy environment can make a habit of using earplugs, and it also should be light free environment. It should be dark, and because these are the stimulus which will help us have our onset of sleep. And it also should be calm, and temperatures also shouldn't be high, extreme, like hot or cold. It should be moderate enough to have a good night's sleep.
So, another question, doctor, that with people who are having mental disorders, is sleep disorder very common issue with such kind of people?
Yeah, it is. As I've discussed, many people who have psychiatric problems, like especially anxiety and depressive disorder, sleep issues are very common. And actually speaking, like the first complaint they come to us is with sleep. Like a person who is already diagnosed with depression, we also give them a warning signal that if they do have impairments in sleep, then it's a kind of warning sign that they're going to have another episode. So it's very common for people to have sleep issues and psychiatric problems, even substance use problems. And as I've mentioned, it's bi-directional. It also influences, it triggers an episode if the person is sleep deprived due to any reason. Some people do have personal functions or certain events which they need to attend wherein they get sleep deprived, and following that they do get an episode. So it's bi-directional when it comes to psychiatric problems and sleep.
So, another question, doctor, that what is a circadian rhythm?
Circadian rhythm. So there is a certain region in the brain which we call a suprachiasmatic nucleus. The term could be complicated, but it is an internal biological clock. As we have clock in our external environment, like in our households, there is an internal clock which maintains a rhythm, like a 24-hour rhythm, to say like it's a day and it's a night. And it helps in the maintenance. I mean, it guides us when we need to get hungry. It guides us when we need to sleep, or it also guides us when certain hormones in the body should be produced. So it's a kind of internal biological clock which maintains our lifestyle in a 24-hour pattern or 24-hour cycle.
So, another question we have from our viewer, doctor, that if a patient is facing sleep difficulties for like 3 nights per week, so is it a possibility that this condition is insomnia?
Yeah, as I've mentioned, at least 3 nights per week. If it persists for about at least 3 months, we call it chronic insomnia. Otherwise, we call it short-term insomnia. There could be various precipitating factors or triggers, or as I've mentioned, any stressful life events or new diagnosis or any kind of causes which might result in these sleep problems. And if it's a short-term problem, we could understand the cause and evaluate it, and we can treat the cause as well as the sleep problem. But it is a problem. It needs to be treated.
So, what is a good sleep hygiene, and does screen time impact sleep?
Definitely. Coming to screen time, it definitely impacts sleep. As I've mentioned, like about the internal clock which we have, the main stimulus which acts on the clock is light and darkness. When there is sun and light and brightness in the day, the rhythm will be regulated in such a way it's a day, and all activities will be accordingly done. And in the same time, screen time before sleep, like it is a kind of brightness which disrupts our cue, like, or the stimulus which we receive, and thus it'll make us more sleep deprived. It is advisable to avoid usage of either TV or phone at least 1 hour before sleep. We shouldn't use at least 1 hour before sleep, so that we could get a good sleep and early onset of sleep. And when it comes to sleep hygiene, as I was discussing, one of the non-pharmacological strategy, or like treatment strategy, many kind of sleep problems can be avoided or can be treated when we follow proper sleep hygiene. It is a very important aspect which was touched upon. Even a sleep hygiene measures should be followed every day, no exception on weekends or holidays too. It is important to have a good routine schedule, like the time we go to bed and the time we wake up. That should be the same every day, especially the time we should wake up. In spite of not having good sleep, also it is important to have a regular time to wake up, because it'll set our biological clock inside and regulate our sleep cycles. And it is important to have good diet, nutritious diet, and it is also important to avoid heavy meals before sleep. People do people do say that hunger interferes with sleep. In the same way, if you take heavy meals or spicy meals, it also interferes with sleep. So it is important to avoid heavy meals before sleep. In the same way, then they can have light snack, and also exercise. A good amount of exercise in the day helps in good night's sleep. And as we've discussed, it's important to avoid screen time before bed as a part of sleep hygiene measures too. And no alcohol, caffeine, or tobacco, especially in the evenings. Even if taken in the morning, can influence sleep in certain individuals, but especially they need to be avoided during evenings and night. And no or less napping time during the day is important. And as we've discussed, good sleep environment, bedroom environment is also important. And bedroom should be used only for sleep and privacy purposes. It shouldn't be used for anything else. People do use bed for eating, watching TV, reading books. The sleep the association we do develop with sleep can be developed with the bed, so that like if it's bed, it's just sleep. In such a way, we should avoid doing other activities. These are the good sleep hygiene habits which can be followed and maintained for even for routine normal individuals, in order to prevent from having a sleep problem, and also in individuals when they have milder sleep issues or recent onset sleep issues, even in chronic persistent insomniacs, along with medication.
So, doctor, as we are aware that sleep is really important for a healthy life. So, how sleep and immunity of our body are related?
How? I'm sorry, I didn't understand.
Of our body are related.
Sleep and
Immunity of body is related.
sleep and that word I'm not able to get it.
Immunity of body.
Okay, as I've mentioned, when we sleep, the immune system will be restored. There are many cells in our body which we call as immune cells, or CD4 cells, CD8 cells. Those cells are the cells which fight infection in our body. And when we sleep, those immune system gets restored, and there'll be production of these immune cells in order to fight the infection. Thus, it is very important for the restorative function of the immune system to happen during sleep, so that it could fight infections. If the person is sleep deprived, not having good amount of sleep, the chance of them getting infected, even with common cold or any other infections, is comparatively increased to the when we compare them to the individuals who have good night's sleep.
So the last question for the session, doctor, what are the different type of diseases or disorders which can be caused due to lack of sleep?
Different kind of
Disorders or health issues which can be caused due to lack of sleep. So we know that insomnia is one of them.
Yeah, there are numerous disorders, as I've discussed medically. It could be hypertension, diabetes, cardiovascular disorders, stroke. These are the diabetes. These are all the medical conditions which could result in, if the person is sleep deprived for longer durations, though not initially for longer durations, but even for shorter amount of times, the changes do happen and they do accumulate, resulting in long-term problems. And when we take psychiatrically, as I've mentioned, like anxiety, depression, these are the disorders, bipolar, manic episodes, these are the disorders which can be triggered because of deprivation in sleep. And immune disorders, even those could occur because of it.
Thank you so much for taking the time to address these questions, Dr. Manasa. This was a very enlightening session. To our viewers, we hope that we could cover all the concerns around the issue of sleep and its impact on quality of life. You can check your sleep score with the link shared in the description. For any health-related queries, please do reach out to a specialist doctor near you. Live Aid provides you all the true and authentic information. Any health concern also regarding the sleep disorders, you can visit our website for the details. For further updates, stay connected with Librate and Good MD. Thank you.
Thank you, everyone. And as I've mentioned, it's important to have a good amount of sleep because it will impact life in various ways. And why we need to be sleep deprived when we can happily have a restorative sleep with treatment. So get yourself treated, and you can have a nice and good sleep.
Thank you, doctor.